So I think Sophie's presentation was really inspiring because it talked about how entrepreneurs need their passion to perform well, right? And I always feel, I think we're a lot of PhD students here, it's like being an entrepreneur, right? You need to be really driven, you are working a lot on your own. So I think that's something like that spark of passion is what we all need in our projects as well. And the project that I'm going to present to you today really has the spark of passion for me, right? So I'm going to present you my job market paper, Bank Presence and Help. And so I want you to imagine that you're being in a small village or a smaller city in a developing country such as India, right? So there's no bank in your area. That means there's low credit supply for the businesses in your area. And you yourself only have a low income job. Now, somebody from your family falls ill, right? So you worry because the little money that you have from your job is not sufficient to pay for a visit to the doctor. And additionally, you cannot rely on financial instruments such as savings accounts, bank loans, or even health insurance. These instruments are simply not available in your area, right? And then finally, you know that even if you could afford to go to the doctor, healthcare providers or healthcare supply is often scarce and of low quality, potentially because these healthcare providers are often themselves credit constrained. Right? So you are stuck in this low equilibrium where you remain ill. So now imagine that a bank enters this area. The first thing that the bank does, what we often think about, is that it provides credit to the businesses, right? So these businesses, now the business activity gets stimulated and you benefit from a higher income. And very importantly, it can use this higher income to invest in health. You can also go to the bank branch directly and ask for services such as savings accounts or bank loans who help you finance the healthcare costs. And very importantly, I'm showing in this paper that banks act as intermediaries between health insurance providers in faraway cities and you as a local household to also offer health insurance at the local bank branch. Okay. And then finally, banks potentially provide credit to healthcare providers, which allows them to improve healthcare supply. So overall, you recover quickly and remain healthy. So this small narrative gives strong motivations to believe that if we increase bank presence, there can be significant and substantial positive effects on health of households. Okay. And despite that, we don't have any causal evidence on the relationship. So in this paper, I'm asking how does bank presence affect health? And in order to causally identify that, I'm using a nationwide natural experiment. That experiment is induced by a policy of the Reserve Bank of India, the RBI, from 2005. And now the RBI really wanted to increase bank presence in very underserved areas of India, right? So it incentivized the banks to set up new branches in so-called underbanked districts. And the definition of an underbanked district is what allows for causal identification in my paper. An underbanked district is defined as a district that has a population to branch ratio that is larger than the national average of that ratio. So that means that districts that have many people, but very few branches, very few bank branches, and this ratio is larger than the national average, they're going to be these underbanked districts where the banks are going to set up extra branches. Okay? And so this ratio, the definition of an underbanked district, allows for a regression discontinuity design, where the ratio is a forcing variable and the national average is the cutoff. So what exactly do I compare? Within a state, I'm going to compare first districts that are underbanked to districts that are banked. And I'm only going to focus on districts within an optimal bandwidth. So that's a feature of the RDD. And I'm first going to show you and investigate whether bank presence increases disproportionately in these underbanked districts. So whether the policy is really biting. And then I'm going to examine what happens to health. So we have a policy introduction in 2005, and I used 2 household level surveys to examine what the health status, how the health status of households evolves. The Indian Human Development Survey, which is 6 years after the policy, and the Demographic and Health Survey, 8 years after the policy. Okay, to also understand a little bit more about the mechanisms, I complement this by other data sets such as the economic census. So let me give you a little preview of the findings. In the paper, I first showed that the banks indeed the policy indeed increased bank presence in underbanked districts. So that's, so to speak, our first stage, right? And then I'm showing that health improves. So the morbidity rate decreases. So households are significantly less likely to fall ill, right? And along with that, I also find they are less likely to miss work. They're less likely to have substantial medical expenses. So all this indicates that households are really becoming healthier. And they also find that health improves along other dimensions than morbidity rates, such as vaccination rates or pregnancies. So what were the mechanisms? I found evidence of almost all the mechanisms I had described to you in the beginning, except bank loans, right? And to further narrow this down, I benchmark my findings to other studies who find that savings accounts or increased income alone are less likely to be major drivers of welfare improvements. So that basically leaves health insurance and credit to healthcare providers as potentially important challenges. And so let me conclude. I provide first causal evidence that bank presence improves health and highlight two previously understudied aspects of banking. Thank you very much.
Great, thank you so much, Kim. We've got a question from Michael here. Michael, would you like to unmute yourself and ask your question?
Sure, thank you, Professor. So I had a question about the bank presence. Do you mean, Ms. Cramer, that's an actual physical bank branch, or is it because I hear a lot of things in the developing world about payment systems involving cell phones and trading involving e-commerce on electronic devices and that kind of thing.
Yes. So here in my study, I actually talk about actual physical bank branches. So whenever a bank wants to open a branch in India, they require a license, right? So that's basically what the RBI uses to incentivize the banks to open. They say you can get a license in a very popular area such as Mumbai if you increase your bank presence in these underbanked districts, right? And they are physical branches. Now, you're completely right. There's this huge and interesting trend that banking now also works without branches, right? So, for example, mobile money banking, right? So these are really exciting trends, but they came up a little bit later than my study. And still, the vast majority of people relies on these bank branches.